So I'm going to start looking at a CT scan that has intravenous contrast on board. It's covering the abdomen and pelvis, and we're going to focus on the gastrointestinal anatomy. So this is the superiormost slice. You can see the esophagus right here behind the heart, or posterior to the heart, and anterior to the thoracic aorta. So here's aorta, and of course for reference, spine. Remember, you're looking from the foot up towards the head of the patient, and that's why the right and left is flipped relative to what you're used to. So here we can see the esophagus as we head inferiorly has a little bit of gas in it. And continue inferiorly. And now we're about to get into the stomach. So again, here's the esophagus. This is liver over here, just for reference. Again, the aorta, and we're seeing some of the diaphragm slip over here. This is the spleen, but we're going to focus now on the stomach. So the esophagus is now joined up with the stomach. And as we head inferiorly, we continue to see the stomach with a little bit of liquid in it. Continue on and see now stomach all the way over to here. It's going to cross back over to the right side of the patient. So here's again stomach right here. I'm just trying to keep the cursor right on a portion of it so that you can see. Now I'm going to scroll a little bit to where you can see that it's communicated now with the duodenum. So this is the duodenum. Let me just scroll back and forth so that you can see that. It's a little bit tough to see because the stomach is so collapsed. So here again, stomach to duodenum. Now just follow the duodenum. So here's again the duodenum. It has three portions, a first, second, third, and sometimes people refer to a fourth as well. But here's the second portion as it's headed straight down towards the foot of the patient, and then the third portion crossing all the way over. So here's the rest of the duodenum. And then we have these loops of bowel, that is the proximal small bowel just beyond the duodenum. And these are called the jejunal loops. So here you see multiple loops of jejunum. Most of the jejunum here you'll see is on the left side of the patient. Okay, so here again, loops of jejunum. These will eventually communicate on to other loops of bowel that are more distal, such as these over here, and that head back over to the right of the patient. And that's the ileum. Okay? So here we can see a number of ileal loops as I scroll through here. Here's a few collapsed ones here. Now here we're in the right lower quadrant of the patient, and this loop of bowel here is the cecum. So this is the beginning of the colon. Okay, this is the large bowel as opposed to what we've been talking about up until now was small bowel. So here you can see terminal ileum, that is the end of the ileum as it's headed into the cecum, which is part of the ascending colon. Okay, so there's the terminal ileum, or TI for short. Okay, again, here's that ileal loop. And then as we come into the cecum here, and now we head back up towards the head of the patient, we're going to be following the ascending colon. Okay, so here's ascending colon, just to scroll back and forth. You can see that. For reference, this is the right kidney. And now we'll see this is the hepatic flexure of the colon. And the reason we say that is that the liver is right here. So watch as it's scrolled. So there's liver. And then we see the hepatic flexure, and this is getting into the transverse colon. Okay. So the transverse colon, again, is right here as we've continued to track along. And in some people, this can be quite long. It can head quite far inferiorly, and some people it doesn't. But again, here's that transverse colon. Okay, and then as we continue on, now it's made its way all the way over to the left side of the patient. And then we're going to go from the ascending colon, transverse colon, now to descending colon. So here's the beginning of the descending colon right here. Okay, you can see this. So here's that descending colon. And here's colon. Then the descending heading down. This one actually had quite a redundant transverse colon. There's the descending colon. Now into the sigmoid colon right here. So right as it reaches back into that left lower quadrant, you'll see the sigmoid heading right down this way. For reference, this is the uterus here. Now we have sigmoid colon. The sigmoid is going to end in the rectum. let's see here. Wow, this person has quite the redundant colon. So it's actually worked its way all the way over here. So again, if you just trace through that, we'd reach sigmoid colon here, and then it's coming over this way. Now you can see it right over here as you continue to follow it. Now all the way up to here. And then it's going to head back down. Here's all sigmoid colon again, and then that's going to end in the rectum. So now we're into the rectum. Again, for reference, here's the uterus. Here's the hips, so right hip, left hip. Okay, then all the way down, so the lower portion of the rectum, which then ends in the anus. So we're now into the anal canal. Okay, and this is about as inferior as we go. So the anal canal ends right about here. For reference, here is vagina. And so we just head back superiorly just to give you a look at things again after you've seen all these loops of bowel. A couple of parts of things that are considered part of the gastrointestinal system that we didn't really talk about so much is the liver. So again, here's the liver. Looking at this here, there a lot of the anatomy in the liver is in its blood vessels. So here you'll see the inferior vena cava, some of the hepatic veins that bring blood back to the inferior vena cava. So here's left hepatic vein, middle hepatic vein, right hepatic vein. And then there's also portal veins. So here's a portal vein coming into the liver. And the liver is a little bit unusual in that a vein brings blood into it along with an artery. The artery is always much smaller. I shouldn't say always, but at least in the normal person. So here is that portal vein, and it's going to branch in most people into a left portal, which is right here. So this left portal, you can see it, and then a right portal. So this is the right portal. So that's a little bit of a look at the liver anatomy. This is the gallbladder right here. It's low density because it's got just fluid filled in it, and that fluid doesn't really enhance with the intravenous contrast. Again, here's the gallbladder. Now this is a CT scan, and so seeing the bile ducts, which are part of the liver, is much harder on this, but you can see a little bile duct right here. So this is a bile duct, but if you really want to see them, there's other modalities that we use. Okay, so that's a look at the gastrointestinal system. One part that doesn't really kind of neatly fit in is the spleen. So again, here's the spleen. We'll do another look that goes at the genitourinary system separately.